I'm recording this in May, which is Celiac Awareness Month, and I wanted to talk to you today about the association between celiac and autoimmune disease and Hashimoto's thyroiditis, another autoimmune disease. We do know that when someone has one autoimmune disease, they're 3 to 10 times more likely to get another. So if you already know you have celiac or another autoimmune disease, the increased likelihood is something you really want to pay attention to. There does seem to be a strong correlation between gluten, whether you have celiac or non-celiac gluten sensitivity, and the thyroid. So when we stand back and we look at what autoimmune disease is, it is your immune system attacking you. So that's where the auto is self. So your immune system, instead of defending you against bad guys like bacteria and viruses and killing off cancer cells, is instead choosing to attack a part of your body. In celiac disease, it's the lining of the small intestine. In Hashimoto's thyroiditis, it's the thyroid itself. And this is the same for all over 100 different autoimmune diseases. It is the immune system making the mistake of thinking a part of your body is something that's worthy of being attacked. So in other words, it's not distinguishing your organ, in this case the thyroid, as self. It's thinking it's a bad guy. So how does that confusion come about? There's many different thoughts on the matter. One is that it starts with an initial insult to the immune system that kind of wears down the immune system because the insult keeps happening. Typically we think of diet, so some sort of food sensitivity or food reaction, gluten being a very common one, also chronic infections and toxins. And that's about it. That's the list. So it's not terribly long, but these are things that have been chronically attacking the immune system, and the immune system has gotten so overwhelmed that it's now making a mistake between self and a true foreigner that should be attacked. So in the case of thyroid, it's interesting because thyroid is hypothyroid is extremely common in this country. You can have autoimmune thyroid, Hashimoto's, without having hypothyroid, although eventually it tends to turn into that. Sometimes people go from hypo to hyper, and they're kind of up and down with the autoimmune disease. But the autoimmune disease is often not looked for because there's no quote-unquote cure. So if you went to your doctor and you said, I'm tired and I'm losing hair and I'm constipated, I have dry skin, I've got achy joints, etc., and they do a standard blood test and your TSH, your thyroid stimulating hormone, is not extremely elevated. I'll come back to extremely elevated in a moment, but if it's not extremely elevated, they'll say your thyroid is fine. They won't then go on to check for the antibodies, TPO and TG, they're called, these antibodies that show your immune system is attacking your own thyroid. So why don't they go on to look for that? Because they say, well, your thyroid seems fine and there's nothing we can do for autoimmune thyroid anyway other than treat the thyroid if it's low or high. So if it's not showing low or high, then we don't even bother looking, which is such a terrible mistake, because if we see this autoimmune tendency by doing these additional tests and we see that these antibodies are high, which shows that your immune system is attacking your thyroid, then we can take the root cause medicine approach and say, okay, the immune system is overstimulated, it's thinking the thyroid is a foreigner, so what can we do to pull that back? And in early days, we have seen reversal of those antibodies and really getting them under control. And what a wonderful thing to do before your thyroid has actually gotten affected. Not to say that we can't, also treat when you've got hypothyroid, but it's so great to look at it in early days. So if you know you're gluten sensitive, or autoimmune disease runs in your family, or you're just sort of frustrated with how you feel with the kind of symptoms I was just mentioning, push for that antibody test with your doctor. It's not something they'll want to do, as I said. They'll say, listen, your thyroid looks fine. Now, I said I was going to come back to that. So TSH, thyroid stimulating hormone. So your brain is sending a message to your thyroid to produce the thyroid hormones, T3 and T4. Now, When the thyroid is not responding to that message, I kind of explain to patients then the brain starts kind of yelling at the thyroid going, wake up, come on, do your job, produce those hormones. And that yelling is seen on the test as an elevated TSH. So the brain starts producing more of this message going, come on, why aren't you doing your job? So the elevation is where it's important. So we like the thyroid stimulating hormone between like 1 and 2. And you can go look at your most recent blood test from your doctor, because they always test TSH. That's pretty much always there. They don't do a comprehensive thyroid panel the way we like to, but they will test the TSH. And a lot of times it can be 2.5, 3.5, even 4 plus, and they'll say nothing. They'll say your thyroid's fine. And we disagree, because there's a very big difference between the quote-unquote normals on our blood tests that are not very sensitive and what I like to show as optimal. That's what you want to go for. You want to go to that for that optimal level on all your blood values. So if you're enjoying this video, please subscribe. Please give it a thumbs up so more people can see it. And you know, there's the beauty of the human body is it knows how to heal, it knows how to repair. We just have to unburden it enough for it to do so. And here at Root Cause Medicine, that's what we do. The body is designed to function for 120 years. It's a very strong, robust machine. So don't give up on yourself. Don't say, you know, I've been to all these doctors and they can't help. They're just not doing the right thing. They're not appreciating the root cause method. They're not appreciating the fact that your body knows how to heal itself. So it's very worthwhile to go that extra step. Now, if you are suspicious about gluten, if you're suspicious about your thyroid, please reach out. We'd be delighted to help. I hope you found this video helpful. If you want more on this topic and others, click here.